Perfect. Well, thank you again so much for being here. We'll get started in just a second. I just want to say at the top, there's going to be about 30, 40 minutes of presentation and programming, and then there will be time at the end for questions. Please use the Q&A function to submit any questions you have at any time. You can also put them in the chat, but it's easier if you use that function. The other thing I'm going to remind myself and others of is because we are providing interpretation, to remember that Spanish is about 20-25% longer than English, and to please speak slowly. As you can see, that is not my strong suit. Anyways, I think with all of that out of the way, I'm going to kick it over to Chris, and he'll get us started. Thank you all so much for being here.
Thanks, Bia. And hey, everyone, thank you so much for joining us and giving us some of your time today. My name is Chris DeGree-Kennedy. I'm the president of the Bell Policy Center, and we're excited to talk with you about some of the things that have been happening at state level. I know there's a lot happening at the federal level. If you've been reading the news this morning, you know that the Energy and Commerce Committee did pass the bill recommending the Medicaid cuts last night. It's deeply troubling how deeply they are planning to cut the Medicaid program, and many of our groups are doing everything we can to try to prevent those federal cuts from happening. In the meantime, the state legislature and the governor are continuing to try to solve problems in Colorado, and we're excited to share with you both the things that we've been able to do to make forward progress, but also to have a candid conversation about the limits of what we can do and the ways that the state cannot respond, so that we can all be working together on building the biggest, best solutions we can in the years ahead. So that's all I'll say at the top here. And with that, I will pass it to my good friend, Manat Singh at the Colorado Consumer Health Initiative.
Hi, everyone, and thank you, Chris. My name is Manat Singh. I use she, her pronouns. I am the executive director of the Colorado Consumer Health Initiative. We have a pretty full agenda, so I will also keep it brief. We have our partners and our friends at the Bell Policy Center and our colleagues at CCHI who are going to go over some of those key things that Chris was talking about. And the only other thing I wanted to mention is something my colleagues have heard me say a couple of times over the past few years, is that this is a moment in time where I'm feeling very strongly that we need to stay stubborn about our goals, even if we're being flexible about our methods as we're going through this. So keeping that in mind as the federal threats are kind of imposing down on us and the state work that we're able to do. So thank you, and I'm going to turn it over to Isabel.
Thanks. I'll briefly walk us through our agenda before we dive into the content. So for anybody who doesn't know me, I'm Isabel Cruz. I use she, her, they pronouns. I'm the policy director at CCHI. Really excited to be with you all here today. So we are going to walk through the overview of the 2025 legislative session. We'll have some time for questions and answers. We'll walk through some of the upcoming milestones at CCHI and at the Bell, talk a little bit, give you a teaser of our legislative awards and some of the fun that will await us at the happy hour tonight. And so we will dive into the picture of session.
So, hi, everybody. I'm Joshua Mantel. I'm the Director of Government Affairs at the Bell Policy Center. Really excited to be here with our good friends at Colorado Consumer Health Initiative. Wanted to walk through a little bit of kind of the big picture of the session before we dive into some of the individual bills and issues that our respective organizations worked on over the last several months. And coming out of the 2024 election, I think the big theme that everybody heard was this affordability crisis. Cost of living is increasing for people across the country, and we here in Colorado are not immune to some of those trends. And that seemed to be something that legislators and lawmakers were really focused on as 2025 session kicked off and went over. And as both Chris and Manat mentioned, the specter of everything that was happening at the federal government really hung over everything that was happening over this legislative session, whether it was trans and LGBTQ plus rights, immigration issues, and just the general funding structures that our state and other states and communities have been relying on for decades being upended, seemingly on a whim. Everything kind of from Washington, D.C. shone a light on the things that we could and could not do to protect the most vulnerable communities here in Colorado. And so we'll go over some of those in a little more detail later. And then, as I mentioned, the funding streams, we were also facing some real funding crises here in Colorado. We were, and I will get into some of the details of the budget in a second, but we were facing down a significant budget deficit here in Colorado with some really uncertain federal funding streams up in the air. And that really factored into a lot of the program and the full session impacts that we saw that we will be coming back to again and again. And so those were kind of some of the big picture items that really hung over and cast a shadow on a lot of the work that we were tasked to do here at the session, and a lot of our partners worked on here too. So I'll let Isabel go through some of the specifics of some of the session here.
Thanks, Josh. Just to walk through some of the session by the numbers. So there were 657 bills introduced, which is slightly fewer than some years, slightly more than other years, but you'll notice that 585 were passed, which is slightly more than usual. I will say that that number is largely weighted by a lot of the orbital bills related to the budget and making that balance that Josh is going to talk about in a moment. Also, as has been a theme throughout his entire administration, the dynamics of the first floor, i.e. Governor Polis, played a large role during session, as there were negotiations that shaped bills and whether they moved forward based on threats of veto or the governor's priorities, including some early vetoes like SB 86, a social media bill that had a supermajority of the legislature on the bill, but then they failed to override that veto. So all of that was really looming over the session, in addition to some of the complications that Josh just mentioned. Additionally, once a bill is passed, that's where the rubber meets the road. And so there was continued implementation of many priorities passed throughout the last several years in the legislature, including the direct care workforce stabilization bill you'll hear about later, and the prescription drug affordability board that you'll hear about a little bit later too. And so I'll turn it back to Josh to talk about the budget.
Thanks, Isabel. Yeah, so the budget was really from the beginning of this session something that lawmakers were very focused on. We ended up looking at about a $1.2 billion deficit just to keep up with the current needs of the state. And that meant that there were very, very few bills that got any traction that had monetary impacts attached to them. So no new programs, very little in terms of existing new fiscal notes. I will say, and a lot of credit goes to the Joint Budget Committee members and the staff over there, that for this year, at the very least, they were able to maintain investments in core programs, most notably some small increases for K-12, very small increase in reimbursement rates for Medicaid, and some increases for higher ed. That doesn't mean that there were not cuts that are going to be felt by a lot of Coloradans. We've worked on a couple of programs that were disbanded, including a household recovery loan program to help with small dollar loans for folks. I know there were others. Property tax deferral programs was unwound at the state level. And then we saw a lot of some cuts and delays for transportation funding that were supposed to go to local governments that were taken apart. I will also say that while this year we were able to maintain those commitments to our core programs, that will likely not be the case next year without some significant structural changes. We are facing a structural deficit. And the reason for a lot of these problems, you may say, well, our economy is doing pretty well. We have low unemployment and we have low inflation, and tariffs haven't really taken complete effect in our economy yet. So our economy is doing well. Why did we need to cut so much? And there's a few things. I think the first part is this was the year that we saw the end of federal funding from some of the COVID-19 pandemic relief money. And so while that was anticipated and the state did a good job of not putting ongoing costs onto one-time dollars, it did mask some of the structural issues we saw specifically in our Medicaid program. We have an aging demographic here in our state where we are a young state, but we are aging faster than a lot of other states are. And so we're seeing more and more impact in our Medicaid program. And that is because healthcare inflation rises much faster, generally speaking, than normal consumer inflation. We're seeing the amount of money needed for Medicaid outstrip the amount of money we are allowed to spend in our budget, which gets to a second major impact here, which is TABOR. The Taxpayer Bill of Rights continues to strangle our ability to fund important core priorities in our state. And that's because we are not allowed to spend all the money that we bring in, and we have severe limitations on how we are able to raise revenue in our state. And so we are continuing to look at ways to change our structural environment and make some reforms that will allow us to compete with other states and put more investment into core programs that support our broader economy, like education, like healthcare, like transportation, like childcare, like higher education, all of these important things. But TABOR really does not allow us to have the flexibility to respond to emerging economic conditions in such a dynamic way. And then finally, I'll just mention, as we've said, just the federal cuts coming down the line that we all know. We're looking at billions of dollars in Medicaid cuts, billions of dollars of tax cuts that will reduce the amount of revenue that we have in our system. And so figuring out ways to try and work around that to make sure that we will have much difficulty funding our things when these cuts come through into our state, but trying to do what we can to brace for those federal cuts, I think was important this year and will be even more important in the coming years. And so with that, I want to turn it over to our friends at CCHI, Isabel and Candace, to walk through their legislative agenda and some of their wins and future work that they're doing before I come back and talk a little bit more about what the Bell was doing these last 5 months and our work ahead as well. So with that, Isabel and Candace, take it away.
Thanks, Josh. Appreciate you breaking down the very complicated but very important implications of the budget. So we're so proud to present to you today our 2025 legislative scorecard that we produce every year. Big shout out to Sophia on our team, who really puts all of the work in on the back end to deliver this really important information about how bills move forward and how legislators voted. So check out the links in the chat for both the Spanish and the English version of this document. And so in this, we walk through some of the key bills in session, and you'll get a taste of some of that today. And if you want to dig more in, would recommend checking out our legislative scorecard. So if you check out the next slide, you can also see a snapshot of how CCHI was active both in the legislature and in the ongoing regulatory processes and all of the fun at the federal level around this potentially really devastating budget. And so check that out. And we are always so proud about the work of our team and our advocates and all of our partners. So I'm going to turn it over to Candace to talk through our first pillar of access and coverage and some key bills.
Hi, everyone. I am Candace Bailey. I am the Policy and Advocacy Manager over at CCHI. I use she, her, aya pronouns. And I really wanted to jump in and talk a lot about the access and coverage care first and foremost. First up was HB 25-1309. This was protection to protect access to gender-affirming healthcare. It codifies gender-affirming healthcare treatments in Colorado law, ensuring that health benefit plans cannot deny or limit medically necessary gender-affirming care. This was led by our partners at One Colorado. We are very proud that this actually passed and that we could collaborate on such important work. Next up is SB 25-045, which is the healthcare payment system analysis. This is directly tied to universal healthcare, and it is a study that will be happening for single-payer, nonprofit, publicly financed, and privately delivered universal healthcare payment system. Super excited about this one. Next up, if you could go to the next slide, please, is our reproductive bills. These are super important because we know that reproduction is being rolled back across the country, and Colorado has continued to be an ally and a front runner in what happens in reproduction care. And so SB 25-129 was the legally protected healthcare activity protections. It strengthens protections for healthcare activities, including gender-affirming and reproductive healthcare. It restricts out-of-state investigations. It ensures confidentiality in prescription labeling and prevents discrimination against providers offering these services. The second was providing emergency medical services, SB 25-130. It basically just kept that emergency departments would provide care to all patients seeking treatment, prohibits discrimination. And lastly was SB 25-183, which was coverage for pregnancy-related services. This implements changes following the passage of Amendment 79, which I'm sure some of you have followed, which repealed Colorado's ban on public funding for abortion care. Next, let's jump into financing reform. And Isabel, I will pass it back to you.
Thanks, Candace. So on this slide, I'll highlight HB 25-1297, Health Insurance Affordability Enterprise Update. So Candace got to tell you some of the good news of session. This is going to be some of the bad news of session. So this bill, which was introduced in March, slightly later in session, sought to increase a fee on carriers by 1% that fund our Health Insurance Affordability Enterprise, which is a fund that supports really important programs that keep healthcare costs low and help improve and increase coverage for Coloradans, like reinsurance, our Omni Salud program for undocumented folks who can't otherwise access subsidized plans on the exchange, and subsidies for folks who receive tax credits. So this, in light of a shortfall that this enterprise was already facing and threats at the federal level for the discontinuation of enhanced premium tax credits that have brought thousands of people into coverage in our state, the enterprise was hopefully going to have this as a parachute of sorts to try and ensure that we could maintain these important programs moving forward. However, due to pushback from our Democrats in the House Finance Committee and from the business community, this bill did fail. And so the Health Insurance Affordability Enterprise is going to have to make a decision about whether to increase premiums by about $2,600 a year on average for families and slash the Omni Salud program by 75%, or increase premiums for about a family of four, these examples, by nearly $6,000 a year and maintain Omni Salud. And so there's going to be some really tough decisions ahead. This was a majorly consequential bill, and we'll be following this in implementation quite closely and hoping that some provisions in 1309 that allow for gifts, grants, and donations in the enterprise might provide some relief as the enterprise board navigates these tough decisions. And then on the HJR 25-1023, I'll leave most of the juicy details for Josh, who's going to talk about this later, but just wanted to footnote that we have been following Tabor very closely as CCHI because the Tabor growth limitations are particularly not keeping up with rising healthcare costs, which is putting an extreme strain on the budget and is one of the main driving factors of the issues that you heard Josh talk about earlier. And so in order to build towards a future where our government can provide necessary services and the needed regulatory framework to ensure we can have an affordable and equitable healthcare system, we need structural reform. And so we followed this and will continue to support the great work of our partners at the Bell and CFI and others that really focus on these types of reforms. So next, I will talk about our industry abuse and consumer protection pillar. I'll start with the good news and then I'll move to some of the slightly less fun news of what came forth in this pillar for this session. So HB 25-1088 was an effort that branched from legislative efforts over a couple of years to build on our surprise billing framework. So that's making sure folks don't get balance bills if they seek care out of network in emergency situations when they don't know, et cetera, right? And so existing federal and state legislation protects Coloradans from surprise bills in most cases, except for bills from public ground ambulances and for non-emergency transports. Although all of us know if you're in an ambulance, it probably feels like an emergency to you. And so the passage of this bill, which passed out of the legislature 100-0, which does not happen that often, was a real great win for the ambulance service providers who led on this bill. We're grateful to the sponsors. for their work on this. And we hope that Governor Polis will sign this bill, although there is a looming threat of a veto in response to some industry concerns from the carriers. HB 25-1151, you've come to our legislative wrap-ups before, you might have heard us talk about this concept. It also relates to the surprise billing protections. So this relates to kind of a debate that started back in 2019 when the first protections were passed about how carriers and providers can work out some of their issues on the back end around payment. And so the way that our law was passed was hoping to strike a stronger balance, learning from some of the missteps in other states that drove up costs and increased power for some large private equity backed providers by limiting the ways that people can go to arbitration to contest payment rates. And so this bill came back again this year and proposed to undermine the balance that has been saving Coloradans money on healthcare by eliminating guardrails on arbitration and allowing all emergency providers to batch unlimited claims. And so we fought hard against this bill in conjunction with the carriers, which we don't often do. We were grateful to the Senate Health and Human Services Committee for striking this down on a bipartisan basis. And we do believe that emergency providers need to be paid according to the standard. And so we will continue to work with them to ensure that they get the right solution for the problem that they have identified in making sure that independent providers in particular can stay afloat. So next slide. So these are two bills that we were excited about that unfortunately did not move forward. So HB 25-1174 sought to create a reasonable ceiling for payments from our state employee health plan that covers, some teachers, some public employees that make our state run, right? So limiting kind of the payment rates for that, because currently in the commercial market, folks are paying about 3 times what Medicare would pay for the same service, and using those savings to support our safety net providers like federally qualified health centers, behavioral health clinics, et cetera, who are really struggling right now. And so due to some of the uncertainty at the federal level around Medicaid payments, as well as challenges and strong advocacy from the Hospital Association and hospital providers, this bill was tabled for now and will not move forward, but we're committed to continuing to bring forward the conversation about accountability for hospital prices, particularly in the commercial market, which we know are causing affordability challenges. And with all of the issues our state budget is facing, we need to ensure that the state is paying a reasonable rate for these services. And then finally, SB 25-198, transparency transactions and medical care entities, which was really spearheaded by Senator Kipp and Senator Weissman in the Senate, sought to create more of a framework for our Attorney General to review mergers and acquisitions in the healthcare space to ensure that they align with the public interest. We know from data that healthcare mergers can oftentimes push up costs, excuse me, and challenge access to care for consumers. And so we were really excited about this bill. Due to pushback in the Senate Health and Human Services Committee, sponsors decided to table it, but are committed to working on it in the interim. And so we look forward to being a part of this process over the interim and talking to you all about this, hopefully in a celebratory way next year. So I'll pass it back to Candace.
Awesome. Thank you, Isabel. I was just looking in the chat and I wanted to shout out all of our partners, all of the wonderful people from community who are on here. And I wanted to give a special shout out to all of the elected officials that have sponsored bills and legislation that the Bell and CCHI have worked on. Without your partnership, this would be impossible. Next up is social determinants of health. This is important for each and every one of us in Colorado. And so the first one up is SB 25-276. This is a protection of civil rights immigration status. For us, this was not something that we were going to lead on, but we absolutely morally knew that this fell in our wheelhouse and that protecting the rights of those with different immigration statuses was so critical for us in the healthcare vernacular. So we're happy to know that we could support and continue to support that as this moves forward. Next up is HB 25-1026. This was the repeal co-payment for the Department of Corrections inmate healthcare. This was really important because we also know through social determinants of health, it is not just when you are a free person, but also when you are experiencing the carceral system, and how important this could be. If you're making 60 cents a day and there is a $5 charge on your account, you're going to work a lot of days just to get to that $5 charge. And that is often the same barrier that was faced prior to the carceral system. We worked on that closely. Next up, if we could go to the next slide, is our workforce and delivery, which was SB 25-083. This was limitations on restrictive employment agreements. This was particularly important because it modified Colorado's laws on non-compete and non-solicitation agreements. The reason this was extremely important is because of the fact that if we didn't have something that was keeping people who were already in rural areas, who were in a demographic that were just not being met, this was going to add another layer essentially for receiving healthcare. So it was really acute in rural and underserved areas, as well as where healthcare access is already limited. This bill just allows providers to move freely between jobs, advocate for better work environments, and ultimately improve the continuity of care. And I'm going to pass it back to you, Isabel.
Thanks. So I'll just walk us briefly through some of our key takeaways from this session. So healthcare, no matter how people tell you in the beginning of session, is always a hot issue, since it's what drives a lot of people to the legislature. One of the top concerns with relation to affordability for Coloradans. And this is particularly salient in years with budget issues, as I mentioned, because healthcare costs are putting a large strain and challenge for the budget, particularly with the Tabor growth limitations. As was mentioned multiple times, and you'll keep hearing it, concern and uncertainty over the cuts at the federal level really changed the conversation around key healthcare reforms that we know are important to improve affordability and equity for patients in Colorado. However, with all of the moving pieces and so many dollars on the line for healthcare, that really stalled a lot of those conversations, and will likely mean that many efforts will be continued next year to further the conversation once we have more clarity about what's happening at the federal level. And then finally, with a lot of new legislators, we realize it's going to be important to create more accountability and understanding about key cost drivers like pharmaceuticals and hospital prices in healthcare to combat corporate power at the legislature, and to really make sure that legislators have the information they need to make consumer-driven decisions in the legislature. And then I'll turn it back to Candace for our final piece on some of the implementation work.
Yeah, thank you, Isabel. So implementation is something that's really important because we all know that getting bills through the legislature is only the first step of policy work. To that end, we want to highlight a few of the many regulatory and implementation areas we work on year-round. CCHI helped to pass Colorado's Prescription Drug Affordability Board into law in 2021. Since then, we have remained active stakeholders in the implementation process alongside many of our partner organizations. We consistently attend and comment at both board and advisory board meetings. As the PDAB finally starts their first UPL process this spring and summer, yay! We look forward to re-engaging with advocates and continuing to speak to the many barriers that exist when it comes to affordable prescription drug access in Colorado. We have also been working with other consumer advocate groups as they work to implement PDABs in other states. Financial assistance and affordable hospital care has also been a long-term bucket of work for CCHI. Hospital discounted care, or HDC, was another big one in 2021, and it was such a win. Since then, it has been a huge implementation focus for us. As HDC has ramped up the Colorado Indigent Care Program, or CICP, It is now being sunset. Alongside all our friends at CCLP, we have been actively working with HICPUF to ensure a smooth transition for consumers and to capitalize on any potential to strengthen HDC itself. Lastly, this past year, we dove deep and completed a thorough implementation check looking at whether this law is currently working for Coloradans across the state. You can find that report on our website if you are interested. And again, shout out to everyone who is working on implementation, policy at all of our partner organizations, and special shout out to the CCHI staff for all the support that we have given and we've received from one another.
Well, thank you so much, Isabel and Candace. As someone who doesn't do a ton of work on healthcare policy, really some fascinating and really important stuff, and really appreciate you guys walking everybody through that. I'm going to jump into some of the Bell's work that was done through this session. And as I mentioned at the top, you know, affordability was really one of these buzzwords that was constantly mentioned in the Capitol. Whether it was Democrats or Republicans, everybody was focusing on affordability. And I think from the Bell's perspective, we were able to really do some work through the consumer protection lens to get at this idea of affordability, making sure that large corporations and small businesses and consumers were all on a level playing field and able to really work in the economy through that way. We worked closely with partners, including those at Towards Justice, Colorado Center on Law and Policy, State Innovation Exchange, and others, to go through a huge suite of what we refer to as kind of consumer protection bills. So a couple of these, HB 1010, which would prohibit price gouging in any kind of declared emergencies. So we saw this during the pandemic. We've seen this kind of during some of the bird flu stuff where corporations have increased prices above and beyond where normal supply and demand would go. And so making sure that in times of crises, corporations are not able to just increase prices for the sake of their profits would be prohibited in the state of Colorado. And then HB 1090 was a bill about junk fees. We've heard a lot about this at the federal level, but these are fees a lot in the housing space here in Colorado where you go to sign a lease and you pay your down payment, and then it turns out you have all of these mandatory fees that you weren't aware of that increase your monthly costs. And if you had known that at the beginning, maybe you would have tried to rent from another place. This would be a bill to mandate transparency around these fees so that it is all calculated in the cost of the good or service, whether it's rent, restaurant bills, or anything else that you encounter within the greater economy, that you know the price before you actually commit to signing a lease or paying that bill. HB 10, and I will say 1010 and 1090 have both been signed into law by the governor, and so those will be going forward part of Colorado state law. HB 1004 would prohibit collusion from landlords in setting rent. You may have heard of some of these companies that basically have non-public data that they use to sell to big landlord corporations to tell them what they can spend, what they can charge on their rent that will be paid regardless of what the market says it is. That would prohibit this kind of collusion. We're awaiting the governor's signature and unclear whether he will eventually sign this bill or not, but we are hopeful that we can do this. This practice, collusion through algorithm, has already cost Denver residents about $136 per month in rent as a result of some of these algorithmic charges. And so we're hoping that the governor will sign this to help bring down the cost of rent here in Colorado. And then finally, in this slide, HB 1020, which was earned wage access. The bill has done a lot of work over the years in the lending space, clamping down on predatory lending practices, including leading the effort in 2018 on payday loans that was passed by one of the largest margins in the history of citizen initiatives here in Colorado to cap the amount of interest they're allowed to spend But as we've gone through this process, we've realized that the technology tends to move faster than the law does. And so there are all of these different lending products that pop up in our state, and then we have to react to them. This is another one where folks can get a forward on their paycheck, either through their employer or even more problematic, just through their bank account. And this bill would have allowed the industry to kind of regulate themselves in this space. And we worked closely with legislators to kind of educate them on this issue. And ultimately, they decided to abandon this particular bill. We're looking forward to re-engaging with folks over the interim and hopefully bring a bill next year to properly regulate these kinds of products to make sure that folks can get the money that they need on a day-to-day, paycheck-to-paycheck basis, but without putting themselves into predatory cycles of debt that really trap Coloradans in poverty cycles that can be really difficult to get out of. So next slide. As was alluded to earlier, a lot of discussion around Tabor and taxes and revenue. This session, I think, the budget situation where it was at really forced a conversation around what to do about our budget situation and how Tabor has impacted that. Representative Sean Camacho from Denver brought forward a resolution that would have sued the state of Colorado, alleging Tabor to be unconstitutional because it prevents a Republican form of government, meaning that our representatives cannot actually represent the interests of their constituents due to the constitutional provisions of Tabor. Doesn't allow them to set fiscal policy. It doesn't allow them to react to economic conditions. And so this would have sued the state to force a question of whether Tabor is constitutionally allowed. Ultimately, this did not make it to the floor, but there was a very robust committee discussion. As Isabel and Candace mentioned, CCHI was there along with many of our partners. I have to shout out our good friends at Colorado Fiscal Institute, who have really been on the cutting edge of a lot of this stuff. And it really forced a conversation that allowed people to understand the impacts of Tabor, how it doesn't allow our state to grow in the way that we need to meet the needs of our people. And it doesn't allow us to make economic policy that fits our state. We cannot cut taxes for low-income people if we're not willing to cut taxes for millionaires and billionaires as well. We're not allowed to raise taxes on millionaires and billionaires without raising taxes on people who are struggling to get by. These kinds of things do not lead to a prosperous economy in our state, do not allow us to fund investments in education and make sure that our teachers are paid living wages, that our healthcare providers can see every patient that needs it. And so we're really looking forward to continuing the discussion on how some of the provisions of Tabor have really hamstrung our ability to fund our states. And then I have these two other bills listed here, 1296 and 173. These would really just allow us through changing definitions, changing tax expenditures to increase revenue, really through current law. And so you saw 1296, which ended up passing, really helped with update what bill we passed last year with some partners to give tax credits to care workers in our economy, whether they do direct home care or they work in our early childhood education sector. We know they are not paid wages commensurate with the work and the labor that they do in our society and the services that they provide that we all depend on to keep our economy and our families running. And so making sure that they are able to get a little bit of extra money to be able to live where they work, to provide living wages for these folks is really essential. And so I was happy to be a part of that bill passing. And then 173 would just change some definitions of how money that enters into our state is allowed to be counted. So they're no longer under our Tabor cap. So they're pulled out. So that is money that we can really have without pushing more money above that Tabor cap and forcing us to give that money back instead of putting it into other really important uses, whether that's healthcare, education, transportation, all that other stuff. Next slide. And then this is kind of a potpourri of other issues that we worked on. Just kind of wanted to give a snapshot of some of the issues. I know some of my colleagues, Efrain Garcia, who works on our housing and wealth building policy, and Perrine Monet, who does our care economy work, are here as well. And just they've done phenomenal work in these spaces to really move our agenda forward and make things better for people in Colorado in these issue areas, and make our state and our economic mobility, which is our mission at the Bell, make that a reality for more people. But I want to also mention the SB 276 that Candace mentioned earlier on immigration status. This was really a response, in some ways, a response to what has been happening at the Trump administration, but really, it's even bigger than that. It's ensuring that everybody in our state, regardless of their immigration status, regardless of their country of origin, has due process of law in the borders of Colorado. We have seen over the last couple of months this being eroded at so many different levels, and making sure that nobody can just get picked up off the street and sent to a detention facility, or sent to a different country without a warrant or subpoena signed by a judge is essential. We cannot be giving data away of the people in our state without a warrant signed by a judge. These things are just fundamental constitutional and civil rights that apparently we in Colorado need to ensure is enshrined in law. And so we were happy to help our partners at Colorado Immigrants' Right Coalition, Colorado People's Alliance, Movimiento Poder, and so many other groups in our state who understand the importance of civil rights and constitutional rights for everybody, regardless of their immigration status. And so happy to see that pass, and we're hoping to see that signed into law in the coming days. As Bill mentioned, the Direct Care Stabilization Board, this was a bill passed last year to really stand up a board to understand what our direct care workers in our state need. These are the people that are caring for all of our loved ones, who are there doing work that is just essential for our loved ones' livelihoods and all of that. And there were recommendations from that board that came through this year. And we were happy to be a part of this with our partners at SEIU to put these recommendations into law, and hopefully see better pay in the future for these workers, know their rights, and the ability to live and work in the same place, and do the work that is necessary to take care of our loved ones. And then moving on into the housing space, SB 167 was a bill that our friends at Garrett Community Ventures brought forward to use some state funds to help to better invest them in order to help provide some down payments for folks in the education industry. So whether that's teachers, nurses, counselors, folks who may not be able to afford their own home and the down payment that comes with it, provide some money that will eventually be paid back into the state, so that our state money is not just sitting there, but actually doing good and helping people that really need it in our state. And again, creating those wealth building opportunities so that everybody can pass on wealth to their children and really continue the economic mobility cycle that we think is so important to the health of our state. Next slide. And then two more housing bills that I want to shout out. Housing protections for victim survivors, which was a priority bill for our friends at Colorado Coalition for the Homeless, really ensuring that folks who are victims and survivors of certain types of domestic violence and abuse do not have to go out and onto the street, and are able to have those protections in housing when those kinds of issues and problems occur in their lives. And so they don't have to really go to those issues of last resort. And then as well as protections for tenants with housing subsidies. And as we see some of these housing subsidies at the federal level go away, really ensuring that that those folks have the protections needed to stay in their homes. So next slide. So just a couple of takeaways from our perspective. You know, as I mentioned, these budget woes, they really, there were a lot of policies that would have loved to see introduced or go forward in their full form, but really weren't able to because of the costs associated with those programs, whether it's in the child care space, which we just did not. We need a lot more money in our childcare space and just were not able to get that money into it this session, hoping to see that continue when economic times are better, maybe through future issues and much other states. Again, Tabor, this big gorilla, 800-pound gorilla in the room of every policy discussion they have, really forces us into bad choices. We cannot really weigh whether we need more revenue versus cuts. We have to look at cuts. We cannot look at more revenue because we have to go to a vote of the people. And so that has a lag time of at least 6 to 7 months if something even were to get passed. And so really not able to respond in time to these dynamic economic conditions. And while, CCHI and ourselves really mentioned a lot of these great bills that passed and these really important policies, the problems are going to get worse. We are going to see more deficits in the years to come because of these growing structural deficits. Isabel mentioned how healthcare has really put an impact on our budget, and that is not going to get better unless we are able to make some real issues in our state budget and really have issues there. And so we're going to need to come up with some real structural reforms and some real tangible issues in the months and years ahead to really take this on. Next slide. And then finally, these changes at the federal level, everything that we talked about at the state legislature in some way, shape or form came back to what is happening at the federal government. And it just cast a wide shadow on all these issues. And there's a good chance that we will be back here this summer working on a lot of these challenges to see if there's any way, shape, or form that we can bring more money into the system to fund the cuts and backfill what we are going to be losing at the federal level, whether that's through education funding, SNAP, the Supplemental Nutrition Assistance Program, Medicaid, and all of these kinds of issues. And so, really looking forward to continue these discussions and hope that Colorado can do what it can to stem what we think will be kind of some devastating issues that come from the federal government. So next slide. And finally, I'll just end with some of the work that we have to come. We need to raise more revenue to support Colorado. And that means taking on Tabor and really coming up with some ways to increase taxes at the top for those who can afford it, while maybe even cutting taxes for those at the bottom and funneling that money into programs that support all of Colorado. We are also seeing conservative interests come at the ballot. We've already seen 89 measures titled at the ballot for 2026. 50 or so of them are coming from a single Advanced Colorado arm. Michael Fields, if those of you know who that gentleman is, a conservative activist in our state who has really made it his mission to enact conservative policy, not through the legislature, not through our elected representative, but through the ballot and multi-million-dollar campaigns that he can bankroll to bring these directly to the people of Colorado. We are going to be working tooth and nail to fight these regressive policies, whether it's at immigration policies, criminal justice policies, tax and fee policies, and really make sure that the people of Colorado understand that these policies would take us back and not move us forward in that way. And then the last thing I'll mention is I think this session made clear to us the importance of working on consumer protection to ensure affordability and reducing corporate power and their market share so that consumers can really understand the costs and these costs do not get raised by sheer corporate power in the market. And then also, as I've mentioned, continuing to work to keep predatory financial products for getting a foothold in this state and working with our partners all over to ensure that we understand what these products are and how we can do a better job of regulating them so that they're not trapping Coloradans in cycles of debt.
Okay. Thank you all so much for that presentation. I love getting to come to this because even though I should know all this already, I always learn something. So thank you so much. I'm going to acknowledge that we're a little short on time. But do encourage folks to put any questions they have either in the chat or to use the Q&A function. If we can't answer it now, I will send some answers in a follow-up email. So really would love to get some questions. There are 2 already in the chat, so I'm going to start with those. First up from Sharon, seems like a Tabor lawsuit would take a long time. Why not put Tabor repeal on the ballot?
I'm happy to take that one. So it's a great question. And yes, a Tabor repeal lawsuit would take a long time. And I think I would also say that understanding whether Tabor is legal or not is a worthy cause, even if it does take a long time. In terms of putting Tabor repeal on the ballot, I think where we come from is that in order for a full Tabor repeal to pass, we need to do a lot more educating around the state to make sure people understand what Tabor is. I think for the vast majority of people who don't do this work every day and aren't kind of on these kinds of presentations and understand the issues, Tabor for them is a check that they get once a year when they file their taxes, and is their right to vote on tax increases. And those 2 provisions are generally popular. People love getting money from the government, and people want to have the right to vote on tax increases. I think where we come in is there are many, many other parts of Tabor, and we would love to take on the other parts of Tabor right now that are not popular. And as I mentioned before, that includes that all income has to be taxed at the same rate, whether you're making $2 million a year and you have 3 homes in Aspen, or you're making $25,000 a year and just scraping by and barely able to put food on your table, you are taxed at the same rate. That is not how this should be. And so we would love to take on the idea that we should be making sure that the millionaires and billionaires in our state are paying their fair share to fund the programs that we all count on that make our state great, and maybe giving a break to those at the bottom who are struggling to get by. And that's the part of Tabor that I think is ripe for taking on, and we are really looking forward to working on that, leading that with a bunch of our partners, including some of those who are here today, and really kind of making sure that people in our state understand what Tabor is. And in terms of the longer term, I think a Tabor repeal is right for a long-term education and ballot measure, but I don't think that right now is that time, but we're looking forward to making sure that people understand what Tabor truly is so that they understand why it's a problem in our state and why we do need to get rid of it in the long run.
Thank you so much. Okay, we've got 2 more questions, and I'm going to go ahead and guess that's all we have time for. So again, feel free to keep submitting them, and I will make sure we get you an answer. Next up from Leslie, can you be more specific of what constitutes a structural reform? And Joshua, I think this was also about your portion, but I'm sure you could answer.
Happy to chime in. And I think the reason why I wasn't specific about it is because I think there's a lot of different ideas out there that could constitute something like that, whether that's lifting the cap on our ability to spend the money that we bring in, whether that's putting in a graduated income tax that makes sure the wealthy are paying their fair share, increasing corporate tax rates so that corporations are paying their fair share. I think there's a lot of different ways to do this. I think the most important part of any structural reform, though, is increasing the revenue that is coming into our state. We do not have the money to support the needs of the people of Colorado, and that spans the gamut. And I know we've talked a lot about healthcare today because that is the biggest driver of a lot of our budget. That is the biggest chunk of our general fund budget in this state, and so that has to be part of the discussion of this and really a central focus of that. But we do not have the money to support any of these other issues as well, whether it's education, childcare, healthcare, transportation, higher education, public safety. It just spans the gamut. And so we just need more money in our system. And I'm open to any idea or policy that does bring in more revenue in an equitable way that's not asking our low and middle income families to pay more, but asking those people who can't afford to pay more to put more into the system so that we can continue to fund the things that we know Colorado needs to fund.
So, okay, I'm going to get into the last question, but before I do that, because it's 1 o'clock, I want to do a couple quick plugs. The first is you all should come join us for this is the fun part, but the even more fun part of this event, which will be this afternoon. From 4:30 to 6:30 at Reverence Brewing. Thank you, Kat, for trying to pull that up. And then just also be mindful that both the Bell Policy and CCHI are having 25th anniversary parties in September. More details on that for a QR code. This will all be in a follow-up email. I'm going to go back to questions now. And then the other reason you should join us this evening is that we have a bunch of legislators and advocates that we would also love to thank. We're going to put them up on the screen for a moment, but we'll get to talk more and say more nice things about them this afternoon. Appreciate you all as I try to cram a lot into these last few minutes. Okay, final question. What preparations are y'all making for an assumed special session, and not just around Medicaid or the Affordable Care Act and health costs to the state, but also for AI regulation?
I can take this one. Thanks, Monica, for the question. So we are doing our best with all the uncertainty about what a special session would be, what the scope will be. So it seems like in relation to a lot of other years, for folks who might not have been hearing these rumors, that there's likely to be a special session, either about an AI, an artificial intelligence bill that passed last year, that negotiations in the interim kind of fell apart and kind of came to the session and sort of crashed and burned in a way that a lot of technology groups are concerned about the implementation date, and consumer groups and other folks are kind of still in clashing with some industry groups on what needs to move forward. And so there's some indication that there might be a special session specifically on this piece, as well as, depending on the timing of any cuts at the federal level, there would also likely need to be a special session to deal with any cuts to Medicaid or other key programs that we're going to have very limited ability to backfill. And so we continue to be in conversation with all the partners in those spaces, from coalitions to, I think on the AI front, the Center for Democracy and Technology has been leading some conversations on how to push forward some important protections in any conversation on the AI bill. So we are doing our best in the uncertainty of the moment. And if anybody's interested and wants to be a part of those conversations, please reach out to us, and we'd love to keep you a part of that.
And I'll just add, along with what Isabel said, we're looking at some of the tax changes that are coming and seeing whether we can close some of the loopholes that will come up from the federal government to get some money for the state of Colorado. The way that Colorado's taxes work is we get everything that happens at the federal government comes into our tax code. And so there are ways to kind of shift that around so that maybe there's some money to be able to fund the needs that are coming in from our healthcare sector as a result of some of the federal cuts. So looking forward to working more with our partners on that and seeing if there's anything that we can do to support the state of Colorado.
Thanks. And that just reminded me too, Josh, that one piece that we're going to be pushing for, depending on the timing of any special session, is that the conversation around the health insurance affordability enterprise is a part of any special session to ensure that we don't have those devastating cuts to that program.
Amazing. Okay, clearly there's a lot to discuss, and we only had an hour to do it. So thank you again to our amazing presenters. Thank you to everyone who joined us. Again, feel free to shoot us any questions. We'll answer them in a follow-up email. That'll also include everybody's contact information. If you want to know more, please join us this afternoon. Thank you also to all of our legislators and advocates who we will give a full appreciation to later. And yeah, thanks everyone for a session. I was gonna say a great session, but a session. Okay. Take care, everyone. Bye.